The annual cost of alcohol-related harm is £21 million, and hospitals can often be the last resort for those suffering injury and harm from alcohol abuse. Well, that's where trained staff at the Turning Point Support and Intervention programme are making a real difference. Nick Thatcher reports.
It's never been easier to buy cheap booze on our high streets, but when it comes to hazardous or harmful drinking, we risk paying a price with our health. In the emergency department at Sunderland Royal Hospital, trained staff are available to speak to people who've arrived here with alcohol-related injuries or illnesses.
My name's Steph, I work for Turning Point, and we've had a referral this morning to come and see you. Is it okay if I have a sit down, have a chat?
A simple intervention like this is designed to be a first step in supporting someone who may have concerns about how much they're drinking.
It's very much about meeting anybody from any walk of life. A lot of people that we meet have never had any support before, and they often come to hospital because they're in crisis. It's not because it's something they're used to doing. So they've perhaps hidden the concerns that they've had for quite a long time, and alcohol or drugs have become a coping strategy. So hospital's been the last resort for a lot of people.
And the heart size looks normal. I can't see any evidence of failure.
Dr. Kate Lambert has been a consultant in accident and emergency departments for 20 years and believes that with services working together like this, patients can be better supported, both in hospital and through what's known as assertive outreach when they leave.
We've got a 7-day service that covers the wards, so we'll see those, and then we have regular meetings every couple of weeks for our top 30 most frequent attenders, for those people who can be coming 50, 60 times a year, really chaotic, really struggle to engage with services, and that's where assertive outreach is most powerful. And we've seen some fantastic turnarounds of people that, otherwise would have been considered as, past the point of rescue, really.
But should local authorities and governments also play their part in promoting sensible drinking, as well as restricting access to cheap alcohol? One leading consultant hepatologist told me the time had come for planning restrictions, minimum pricing, and even calorie labelling.
Our high streets are full of fast food stores and cheap liquor stores. If we could take public health as a licensing condition, that would make a big difference. And of course, pricing. If we could really tackle the cheapest alcohol through some form of minimum floor price for alcohol, that would make a huge difference.
And would calorie labelling make a difference?
I think it's monstrous that you get more information on a tin of beans as to its contents than you do on a bottle of wine or a bottle of spirits. Now, the evidence that it's going to turn the country around tomorrow is not great, but the general public have a right to know what they're putting into their bodies, and that right is being fulfilled much better for fruit and vegetables than it is for alcohol.
But while many agencies could play a bigger role in tackling the harm cheap alcohol can do, back on the front line in the hospital, the cost is seen every day. Here it's hoped talking about alcohol can be a turning point for someone who's worried about their drinking before it becomes too late.